Thank you, and I really appreciate the opportunity to be here, Senators. I am really encouraged by the conversation that I've been listening to, because as an organization that has been representing the interests of women and families for more than 35 years, I can say that the urgency is very great. People want us to transform this delivery system. They get that it's broken. They get that it isn't working as well as it should. They want better quality care. They want it to be more affordable. And they also get that we need to get better value for our health care dollars. They know we need to make changes to make this all sustainable over time so we can ultimately get to coverage for everyone. And one of the most exciting things I think about this conversation today has been the amount of focus on what's needed for the patients. And Dr. Steele said something very profound when he started us off. He said at Geisinger, they started first by looking at what the patient's needs were. And then they designed delivery and the way they were going to pay for it around those patient needs. And if there's one message I'd like to deliver, it's that I think we need to think about delivery system reform, payment reform from the perspective of, is it going to get us to making a more patient-centered system? Will it meet the needs of patients? And will it meet the needs of the highest risk, most vulnerable patients, the ones who are falling through the cracks the most, but the ones who are also costing us the most money? We know that the folks with multiple chronic conditions are costing us at least 75% of our health care dollars. And that's only going to get worse. The population is aging. The number of chronic conditions people have is escalating. And from a women's perspective, especially, women who are reaching those middle years, the baby boomer generation of women who are now just beginning to deal with their own chronic conditions, also facing the caregiving responsibilities of dealing with aging relatives who are living longer with more complex conditions than ever. Their struggle with the shortcomings in this fragmented, uncoordinated delivery system are just going to be off the charts. So the conversation today about shifting to primary care, shifting our payment system so it incentivizes us to move toward better integrated, more coordinated, shared accountability, that all makes sense. I'd like to just put a spin on that if we look at that from the patient perspective. Some of the same things, what it takes us to. So, for example, we talked about needing to really move from acute care focus to focus on managing chronic conditions and more focus on primary care. Well, we have to value primary care more and differently than we do today, but we also probably need to think differently about how we go about that valuation process. Right now, we look at resource costs and we assign values. Well, we don't look at the values to patients. And what would happen if you included a patient voice in how we establish the payment decisions around what's valued and revaluing primary care? The medical home model moves us in the right direction. It's the right idea. But as it stands now, it won't meet the needs of the most vulnerable patients, those folks with the multiple chronic conditions, those folks with geriatric syndrome. Senator Lincoln, you have legislation that gets at the importance of geriatric assessment, for example. Senator Wyden, you have legislation that looks at the importance of making sure we can deliver care to people at home. Right now, the medical home is not there. We need to evolve it. So we need to think about this as getting to primary care payment that pays for the right services based on patient needs, which probably means some kind of a risk-adjusted model that's matched to patient complexity and covers those things like geriatric assessment and care at home and making sure we have the link to community-based services. So putting the patient lens on some of these things, I think, helps steer us in the right direction. With respect to your question, Senator Menendez, about women having particular needs, that's another example of us needing to ensure that we're matching what we pay for to the actual patient needs. And I think the important thing here is that we want patients to be able to choose where they get their care. And for many women, an OBGYN is their provider of choice. But we then need to make sure that those OBGYNs are providing the full range of primary care services or linking to those services so women get the full range of services that they need. So I think there are ways we can move in the direction of ensuring that women in their peak reproductive health years that have a range of needs have those needs met in the context of getting comprehensive primary care.